Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. Let's practice applying what we know about presumptive, probable, and positive signs of pregnancy. Question number 1. A nurse is assessing a client who believes she may be pregnant. Which finding is considered a presumptive sign of pregnancy? A. Positive urine pregnancy test. B. Nausea and vomiting. C. Chadwick sign. Or D. Palpable uterine enlargement. For this question, the best choice is B. Nausea and vomiting. And if we look at the rationale, we find that nausea and vomiting is a presumptive sign of pregnancy because this is subjective information that's being provided to you by the client. This is things she's telling you she's experiencing, like nausea and vomiting, or missing her period, or needing to pee a lot, or things like that. The word presumptive has an S in it to remind us that presumptive signs are subjective signs. The other options for this question were all objective signs. These were all things that could be evaluated by the nurse. And so objective signs are considered probable signs of pregnancy, and probable has an O in it to remind us that these are objective findings. So for this question, the objective options were positive pregnancy test, Chadwick sign, and palpable uterine enlargement, which are all things that the nurse could assess. Question number 2. A client has noticed her nipples are enlarging and getting darker pigmented. What type of pregnancy symptom is this? A. Presumptive. B. Possible. C. Probable. Or D. Positive. The best choice for this question is A. Presumptive. And the rationale for this question is based on the fact that, again, this is information that she is telling you. If she is noticing darker pigmentation on her breasts, you could, as the nurse, look at them, but you don't know what they looked like before. So this is still information provided to you that is subjective from the client. Other things that can be subjective include urinary frequency, amenorrhea, nausea and vomiting, like we talked about with the last question, fatigue, and also quickening. Question number 3. Which of the following is a positive sign of pregnancy? A. Fetal movement felt by the mother. B. Positive pregnancy test. C. Enlargement of the uterus. Or D. Fetus visualized on ultrasound. The best answer for this is D. Fetus visualized on ultrasound. Because of all of these options, this is the only one that is coming from the baby and can be assessed by the nurse. So when we look at the rationale, we find that positive signs of pregnancy have to come from the fetus and be assessed by the nurse or the healthcare provider. So if the nurse can see the fetus on ultrasound or an x-ray, can hear the fetus, the heartbeat on ultrasound or Doppler, or can feel the baby's fetal movement on palpation, these are all positive signs. They're all things that we can assess that's coming from the baby. So here's some of our positive signs. For the other options in this question, A was fetal movement felt by the mother. This is called quickening, and it's considered a presumptive sign of pregnancy. It is a subjective feeling that she could experience that I can't assess, that the doctor can't assess. And this could be other things like gas. We don't know what exactly she's feeling. B, positive pregnancy test. This is a probable sign of pregnancy. So pregnancy tests are very accurate, but there are rare cases that the body could have HCG that would cause a pregnancy test to show positive if she wasn't pregnant. So it's not considered a definitive positive sign. Remember, our positive signs have to come from the fetus. And then enlargement of the uterus is also a probable sign of pregnancy. It is objective information that can be assessed by the nurse or the doctor, but there's other conditions that can cause uterine enlargement, like tumors and fibroids and things like this. So this is not a conclusive indicator of pregnancy either. Question number 4. A client who believes she may be pregnant is discussing symptoms with her nurse. She describes feeling like butterflies or bubbles in her uterus. What presumptive sign of pregnancy is the client describing? A. Quickening. B. Amenorrhea. C. Hegar sign. Or D. Ballottement. The best answer for this question is A. Quickening. When we look at the rationale for this, we find that quickening is a presumptive sign of pregnancy because this is still subjective information told to you by the client. However, typically those sensations of flutters and bubbles and butterflies are those first fetal movements. They typically happen around 18 to 20 weeks gestation, but they're only felt by the mother. I can't assess it, so it's still considered a presumptive sign. Question number 5. Which of the following is not a positive sign of pregnancy? A. Fetal kicks felt by the nurse. B. Fetal heart tones heard by Doppler. C. Visualizing the fetus on ultrasound. Or D. Braxton Hicks contractions. So remember that positive signs of pregnancy have to come from the fetus. And so if the nurse can feel fetal kicks, that's positive. If the nurse can hear the heart tones on Doppler, that's positive. And if we can visualize the fetus on ultrasound, that's positive. Braxton Hicks contractions, however, are not a positive sign of pregnancy because they are not coming specifically from the baby. So there's other things that could cause a uterus to enlarge or contract, rarely. And so it is not a definitive sign of pregnancy. So when we look at the rationale, Braxton Hicks are uterine contractions that occur throughout pregnancy, but they don't confirm the pregnancy definitively. They're considered a probable sign. In order for the sign to be positive, it has to come from the fetus, not from the mother. So being able to palpate uterine enlargement or Braxton Hicks contractions are both objective and probable signs of pregnancy. Question number 6. The physician has documented the presence of a Chadwick sign. The nurse determines this is a positive sign of pregnancy, B, probable sign of pregnancy, C, a concerning sign of pregnancy, or D, the presence of HCG in the urine. The best answer for this question is B. This is a probable sign of pregnancy. So when we look at the rationale, we're reminded that probable signs are objective findings that can be assessed by the nurse or the physician. And so any of the signs, Hegar sign, Chadwick sign, Goodell sign, these are all probable. Also the positive pregnancy test, being able to palpate uterine enlargement or contractions like we discussed with the last question are all probable. So these are findings that we can typically see with pregnancy, but they're not definitive unless it's coming from the fetus, right, for probable. With Chadwick sign is the bluish discoloration that can happen with the cervix and the vagina with pregnancy. Question number 7. A nurse is assessing a client who believes she may be pregnant. Which finding is considered a probable sign of pregnancy? This should be easy. A. Nausea and vomiting. B. Quickening felt by the client. C. Positive urine pregnancy test. D. Visualization of the fetus on ultrasound. So remembering everything that we know, A, nausea and vomiting. This is subjective information from the client, so that's presumptive. B, quickening felt by the client. It's felt by the client. It's subjective information. C, positive urine pregnancy test. This is something the nurse can assess. This is objective information. It's probable. And then D, visualization of the fetus on ultrasound. That's coming from the baby, so that's a positive sign. So the best answer for this is C, positive urine pregnancy test. So when we look at the rationale, we're reminded once again that our probable signs are objective findings that are suggesting that there is a pregnancy, but it does not diagnose the pregnancy specifically. Okay, there are other things that can cause HCG to be elevated in the body in rare occasions. Presumptive signs were the nausea and vomiting and the quickening in the question. And then our positive sign is our most diagnostic sign, and that is being able to visualize the fetus or palpate fetal movement or hear fetal heart tones. Question number 8. The pregnant client at 10 weeks gestation exhibits the following signs of pregnancy during a routine prenatal checkup. Which ones would be categorized as probable signs of pregnancy? This is a select all that apply question. So A, HCG in the urine, is that objective or subjective? That's objective, so it's a probable sign. B, breast tenderness. Is that objective or subjective? That is subjective, so it's a presumptive sign. C, fetal heart sounds. That's coming from the baby, so that's a positive sign. D, Hegar sign. Is that objective or subjective? That's objective. The nurse can assess, so that is a probable sign. E, amenorrhea. Is that objective or subjective? This is subjective, so it's a presumptive sign. And then palpable fetal movement is coming from the fetus, so that's a positive sign. So the ones of these that are probable signs are A, HCG in the urine, and D, Hegar sign. Those are both objective findings that are probable signs of pregnancy that can be assessed by the nurse or the provider. And that's what the rationale says. HCG in the urine and Hegar sign are probable signs of pregnancy. Our presumptive signs are going to be our missed period, our nausea and vomiting, our breast changes and quickening, and our positive signs are our truly diagnostic signs that come from the fetus. So being able to see the baby, hear the baby, or feel the baby. So let's recap. Presumptive signs are subjective information from the client. The word presumptive has an S in it to remind us that our presumptive findings are subjective. This includes things like amenorrhea, nausea and vomiting, and frequent urination. Probable signs are objective findings on assessment, and probable has the word O in it to remind us that this is our objective findings. And our probable signs are things that mean she's probably pregnant. Positive pregnancy test, any of the signs, Chadwick sign, Hegar sign, Goodell sign, Ballottement, and Braxton Hicks contractions all are probable signs. Our positive signs are diagnostic because they come from the fetus. And so I can either hear, see, or palpate fetal movement. So I can hear the heart tones, I can see the baby on ultrasound, I can palpate the fetal movement. Those are positive signs of pregnancy. If we look at them all together, here are some of our presumptive signs. Amenorrhea, fatigue, urinary frequency, nausea and vomiting, breast changes, and quickening are all presumptive signs that are subjective coming from the client. Probable signs are objective. These are things we can assess. Positive pregnancy test, Hegar sign, Chadwick sign, Goodell sign, Ballottement, and being able to palpate uterine enlargement or Braxton Hicks contractions. And then our positive signs come from the fetus. So this is ultrasound, this is x-ray, this is being able to hear the heartbeat with either ultrasound or Doppler, or for the provider to be able to palpate the fetal movement. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.